All right. Good afternoon, everybody. My name's Linda Hughes. I'm the chair of Alberta Health Services Board, and I'm happy to welcome you to our second public board meeting of 2017. A little later, Dr. Verna Yu is going to share her thoughts on how the organization is working to improve the quality of healthcare delivered every day across the province. For now, I just wanted to say a quick thank you to all of those of you who are involved in providing care across Alberta. This is a high-demand profession, and one of the benefits of being in my position is that I get to see firsthand all the good work that takes place across the province. So to our staff, to our partners, our advisory council members, our foundation partners, thank you for being committed to quality, and thank you for your contributions every single day. We have a full agenda here today. First, we'll hear from the Community Engagement Committee, which is seeking board approval on 3 matters: advisory council member renewals and appointments, appointments of trustees to health foundations, and amendments to provincial advisory council bylaws. We'll also hear from the Finance Committee about 2 matters. Committee will recommend the board approve a contract for a 6-year supply of product used in the treatment of multiple myeloma and other conditions, and delegate authority to sign that contract to our AHS President and CEO, Dr. Yu. The Finance Committee will also seek ratification of the investment portfolio and transactions. We'll also hear reports to the board from Governance, Audit and Risk, and Human Resources Committees. So, does everyone have their agenda? Could I ask somebody to move approval of the agenda? Linda, Hugh, all in favor? Thank you. Does anybody have a conflict of interest to declare at this time? Seeing none, thank you. All right, let's move along to Dr. Yu.
Thank you, Linda, and good afternoon to everyone. I'd like to share a few words about quality improvement, but today I'd also like to do it in a slightly different context. I've often shared news at our public board meetings about the many projects and programs that are improving the quality of care in a specific area of the healthcare system. But today I'd like to talk about the pace of improvement, and especially in a province-wide healthcare system like ours. Many times over the course of a year, processes will be changed and resources shifted in order to make small-scale quality improvements that have an almost immediate effect. However, larger systemic improvements typically take a lot more time. We're talking months and years, not days and weeks. So it's important we remain committed to courses of action when we know they deliver the results that we seek, even if there's no instant gratification. In other words, some things are worth the wait. For instance, as an organization, we've taken many actions to improve patient satisfaction rates at our hospitals across the province. This is neither a quick fix or an easy job for AHS, or in fact for any healthcare system. AHS uses the Hospital Consumer Assessment of Healthcare Providers and Systems, or HCAPS, to evaluate patient experiences in Alberta hospitals. Overall, 82% of all patients surveyed in 15-16 rated their hospital care as 8, 9, or 10 out of 10. Although that's 3 percentage points below our provincial target of 85%, the good news is the upward trend of satisfaction rates at specific sites demonstrates sustained local actions can improve healthcare experiences for patients. For example, patient satisfaction rates at Fort Saskatchewan Community Hospital have increased from 83% to 93% since 2012-13. That's a significant improvement. The Fort Saskatchewan facility is one of 27 AHS hospitals with patient satisfaction rates currently over 90%, which shows that pockets of excellence truly exist. We know that by sharing the best practices of hospitals with excellent patient satisfaction rates, we can finally move the needle in the right direction province-wide. We're also making tremendous strides in the area of cancer control, thanks to years of difficult and coordinated work, especially related to early detection and cancer screening. Alberta's cancer incidence rates have declined by about 0.6% annually between 2001 and 2014. And mortality rates have also decreased over the past 20 years, falling on average by 2.1% annually between 2004 and 2014. These are life-saving improvements that are achieved by being committed to well-conceived, long-term strategy over the course of many years. I believe that AHS efforts to embed the principles of patient and family-centered care through our patient-first strategy will also require sustained effort over many years. We launched the patient-first strategy nearly 3 years ago, and since then we've been hearing more and more stories from patients and families about how, now more than ever, they are at the center of their care and involved in all decisions about their care. Their stories confirm that we're on the right track. And I'd like to share one such story with you. Patricia Kuyava is an Edmonton woman who delivered all 3 of her children at the Royal Alexandra Hospital. Her first child, a boy named Gabriel, was born 13 years ago. And her most recent child, a daughter named Helena, arrived last September. Patricia reached out to AHS because she wanted us to know that she recognized and appreciated the fact that from her perspective, AHS is now doing a much better job listening to patients and families. She pointed out that that wasn't the case when she gave birth to Gabriel. Patricia said that back then, there was very little dialogue with her care team, that her care team didn't really respect her preference to give birth without pain medications or other interventions, and that she didn't feel fully supported during her 14-hour labor. Patricia told us, quote, "I just wanted to give birth to my baby the way I wanted to give birth to my baby." And in the end, she did give birth to a healthy baby boy, according to her wishes, but not without undue stress and conflict. But that was then. Patricia was so happy with her recent labor and delivery experiences in 2014 and 2016 that she decided that she wanted to return to the unit and show her appreciation. Our cameras were there, and I'd like to give you a sneak preview of a video that we will be sharing with Albertans on our website in the next few days.
Helena's birth was probably my most difficult birth out of the 3. Helena was turned the wrong way and she was wrapped in her cord. So my labor was very erratic to start. The possibility of a cesarean started to be brought up. Really didn't want to have a C-section. I had my other 2 births naturally without any pain medications or epidurals, and I was hoping to have the same with Helena. First of all, they didn't impose anything on me. They discussed it with me. They told me where things are at. They told me what the ramifications and what the possibilities were, what the possible outcomes were. I went in with Helena probably around 10 o'clock at night, and I was there until 7 o'clock in the morning. And so I had a nurse who'd say to her whole shift. And at 7 o'clock, her shift ended, and she said, no, you know, like I'm going to see this through, which I was very much touched by. Natalia and I are making them some cupcakes, and we're going to give it to the nurses as a thank you for doing their job so well and for caring. We came.
Oh, making my heart go.
Yes, you helped exactly 3 months or 4 months and a day ago to deliver Helenka.
Oh, well, thank you
Yes,
so much.
Thank you.
Oh.
Yeah, we wanted to say thank you because, yeah, this was the second very, very good experience I had on this floor and with all you ladies. With her and with her 3 years ago, almost exactly. So we just celebrated her birthday and we just celebrated her month day yesterday, so and she helped make the cupcakes yesterday so that you can all have a treat.
Can I have a hug?
It blew me away. It just is so heartwarming that there's no words to describe how nice that makes you feel. And it's almost like it's unbelievable that somebody would appreciate what you've done for them. Can we hold the baby? The patient is your first priority. And every step of the way, you're doing what you can according to the patient's birth plan, as it's safe for the patient and safe for the baby.
It's very nice to be recognized when you do a good job, but when we see this happening, they come in and they say thank you and we've done a good job. It's amazing. It's a good team building experience too.
It just makes me want to keep doing what I'm doing and just give everything I have for the patient. I'm at the place where I've always wanted to be, and I just love my job.
Patricia shows us how patient and family-centered care enhances patient outcomes, patient and health provider experiences, and overall quality of care. We know we're on the right path with the patient-first strategy, and we're committed to demonstrating patient and family-centered care during every patient encounter, wherever patients access the health system. But this requires a culture change, a systemic change, and that takes time. But rest assured, just as we're gradually increasing patient satisfaction rates, and just as we're reducing the rates of cancer incidence and mortality, we will work to advance patient and family-centered care in our organization every single day, month to month, and year to year. We will get to where we want to be. And that would mean we have more patients like Patricia who feel supported by a health team and a health system that's respectful and responsive to Albertans' needs, preferences, and values. And this will be time well spent. So thank you for your time today and for your interest in Alberta Health Services.
Thank you, Verna. Lovely video, lovely report. That's great. Thank you. So now we'll move on to committee reports, and we'll start with community engagement.
Thank you, Madam Chair. The Community Engagement Committee met on February the 9th. Mr. Casey Eaglespeaker, Vice Chair of the Wisdom Council, and Ms. Brenda Labocane, Aboriginal Engagement Officer of the Aboriginal Health Program, attended the meeting and gave a very interesting presentation on what they perceive as opportunities, results, and challenges in healthcare in this area. The committee at that meeting also considered 3 recommendations for approval, which I'll bring forward now. With respect to the first item, under the amended bylaw for Alberta Health Services, establishing health advisory councils, the HS Board is required to approve renewals and appointments of members to the health advisory councils. In addition, under the bylaws for each of the Addiction and Mental Health Provincial Advisory Council and the Cancer Provincial Advisory Council, the HS Board is required to approve membership appointments as well. The committee reviewed the appointments to certain advisory councils effective March 1st, 2017, and recommended that the AHS Board approve such appointments. We're very grateful for the commitment of our volunteers across the province. We value their work and appreciate their commitment to healthcare in the province. Given the number of appointments that there are, the names will not be read at this meeting, but they will be incorporated into the minutes and posted publicly. Accordingly, I move that the Alberta Health Services Board approve the member renewals and new appointments to the Health Advisory Councils, the Addiction and Mental Health Provincial Advisory Council, and the Cancer Provincial Advisory Council effective March 1st, 2017, as reviewed by the Alberta Health Services Board. I so move.
Seconder, Marlis? All in favor? Great, that's carried. Thank you.
With respect to the second item, the responsibility to appoint trustees to establish foundations also lies with the AHS Board pursuant to the Regional Health Authority's Foundations Regulation. The committee reviewed appointments to certain foundations effective March 1st, 2017, and recommended that the AHS Board approve such appointments. Again, we are very grateful to the commitment of our foundation volunteers across the province and value their work and appreciate their commitment. And again, given the number of appointments, the names will not be read in this meeting, but will be incorporated into the minutes of the meeting and posted publicly. Accordingly, I move that the Alberta Health Services Board approve the trustee appointments or reappointments to the foundations effective March 1st, 2017, as reviewed by the committee and Alberta Health Services Board. I so move.
Could I have a seconder? David? All in favor? Great, that's carried. Thank you.
And finally, the committee was presented amendments to the Addiction and Mental Health and the Cancer Provisional Advisory Council bylaws, which also require board approval. The committee recommended the board approve the revised amended bylaw. Accordingly, I move that the Alberta Health Services Board approve the proposed revisions to the Addiction and Mental Health Provincial Advisory Council amended bylaw, as well as to the Cancer Provincial Advisory Council amended bylaws, as reviewed by the committee, and direct management to forward the revised bylaws to Alberta Health for the minister's approval. I so move.
Seconder? Glenda? All in favor? Great, thank you, carried.
Thank you very much, Brenda. So moving on to governance.
Thank you, Madam Chair. The governance report is for information and does not require passage of any motions at this time. I can advise that the Governance Committee last met on February 9th. At that time, the committee reviewed the board member skills and competencies matrix and the board evaluation survey template, which we will be using to conduct board evaluations this spring. The Chief Ethics Officer attended the meeting, provided her quarterly update on the Ethics and Compliance Department. There were no items before the committee that required passage of motions by the board, so that concludes the governance report. Thank you.
Thank you, Hugh. Finance Committee, David?
Thank you, Madam Chair. The Finance Committee met on February the 15th. The committee had significant discussions on the 2017-18 budget. In addition, the committee had 2 items to consider for recommendation for board approval. With respect to the first item, the committee recommended the board approve a contract between Celgene and AHS effective October 1, 2016 for a 6-year supply of Revlimid and delegate signing authority of such to the AHS President and CEO. Accordingly, I move that the Alberta Health Services Board 1. Approve a contract between Celgene and Alberta Health Services effective October 1, 2016 for the 6-year supply of Revlimid upon the terms and conditions presented to the Finance Committee. And secondly, delegate authority to Alberta Health Services President and CEO to sign the contract on behalf of AHS.
Could I have a seconder? Glenda? All in favor? Thank you, carried.
With respect to the second item, as mandated by AHS Investment Bylaw, the Finance Committee is required to review reports prepared by management and investment managers, summarizing the activities and performance of AHS investment portfolio on a quarterly basis. Regional Health Authorities Regulation and the AHS Investment Bylaw describe the requirements for the board to approve or ratify by resolution AHS investment decisions. The committee was presented with the December 31, 2016 third quarter investment report and recommend that the board ratify the transactions. Accordingly, I move that the Alberta Health Services Board ratify the investment portfolio and transactions described below as certified by signed investment compliance certificates from AHS and Phillips Hager North Investment Management. A, as at December 31, 2016, AHS held restricted and unrestricted funds managed by Phillips Hager and North Investment Management and Standard Life Canada, totaling $1.497 billion. B, funds were invested in short-term treasury bills, federal and provincial and corporate fixed income bonds, pooled mortgage funds, bond funds, Canadian and global equity funds. And C, all of the funds invested during the quarter ended December 31, 2016 were invested in accordance with the investment bylaw and investments policy as certified by signed investment compliance certificates from AHS and PH&N.
Thank you. Could I have a seconder? Brenda? All in favor? Thank you, that's carried.
Thank you, David. Now we'll have the Audit and Risk Committee report.
And the Audit and Risk Committee has no recommendations, so it's just a brief report on the meeting, which was held on February the 15th. In accordance with the usual practice, representatives from the Office of the Auditor General and KPMG attended the meeting. The committee discussed various audit matters, including the status of the outstanding internal and external audit recommendations and AHS property insurance. There were no items presented at the committee to be considered for board approval, and that is the report of Audit and Risk Committee.
Thank you, David. And finally, HR Committee. Richard.
The committee met yesterday.
I messed up already. Just had 3 inches. The committee met yesterday and discussed a number of measures. One was the success indicators under our people strategy. Secondly, we received an update on labor relation matters and essential services and discussed performance in regards to workplace health and safety. The committee also was provided with an executive leadership succession planning process and received an update on the application to become one of Canada's top 100 employers. There were no items for approval, and this concludes my presentation.
Thank you, Richard.
You're welcome.
If there's nothing else, I would take a motion to adjourn. Marlis, seconded by Hugh. All in favor? Thank you very much. We're adjourned.